The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name is Mark Ryan, and it's a pleasure to be hosting the podcast. And thanks to everyone for listening in. Today, we are now post-election. We're recording this about a week and a half early here, but we are post-election. And I am going to reflect a little bit on what will happen in healthcare with the GOP firmly in control. So we'll get right to it. We'll take a couple of breaks to break this up a little bit. But let's give a brief overview about what actually happened during the election. Now, keep in mind, again, we're taping this about 10 days early. So not everything is totally concluded yet, but we have a pretty good picture. So if there's a slight difference, you'll know it's because we taped this about 10 days or so before it was broadcast. But while the weeks before the election certainly favored the election of Republican Donald Trump as president, the election outcome was, in fact, to me, stunning. For the first time since George W. Bush in 2004, a Republican won the popular vote by slightly less than 4 million votes and a majority of voters at last count. Leading up to the election, the Electoral College certainly looked like there were 7 states that could swing either way. Polls were largely within the margin of error for Nevada, Arizona, Georgia, North Carolina, Pennsylvania, Michigan, and Wisconsin. Now, in a lot of my writing, I have said I wasn't exactly sure that that was the case, right? That Trump voters tend to be undercounted for various reasons. There's bias in polls. Sometimes Trump voters don't like to talk to pollsters, as an example. So I didn't think they were exactly in the margin of error, but I would never have predicted that Trump would have won all 7 of those swing states. And again, he won all 7, and he actually beat Democrat Kamala Harris 312 to 226 in the Electoral College, again, sweeping all 7 of those battleground states. While many often saw Trump as herding down ticket candidates, meaning he didn't have a lot of coattails, he certainly had major political coattails this election. The GOP was always favored to take back control of the Senate with 51 of 100 votes. We figured that West Virginia and Montana would flip, but the huge win for Trump helped at least 2 additional GOP Senate candidates win, bringing the GOP majority in the upper chamber to at least 53 votes. As we were taping this, the Arizona race had yet to be called by some, but it looked headed to a Democratic victory. So we were reasonably sure that there would be 53 votes for the GOP and they would take over the Senate chamber. I also reported in my writing that based on all the polls out there, the House was really expected to be a tight contest. And that's honestly what we are seeing. Again, the House control has not been decided yet, but the GOP is almost assured to stay in control based on what I see today. It has between 213 and 216 of the 218 needed to have a majority in control, and there are about 15 to 20 seats yet to be called. Several races are in California, which have a lot left to be called, and the GOP actually performed pretty well. There's also an open contest still up in Alaska that looks like it's headed toward the Republicans. So it looks like right now that the Republicans will probably end up with maybe a couple additional votes, even beyond the 220 they have today. So it's still a very, very tight majority for the GOP. And so, with that, we're going to take our first break and come back and begin to get into our story about what actually might happen with healthcare moving forward. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the recent election and the fact that the GOP will now control the White House, the Senate, and very likely the House. And so what does complete GOP control mean to healthcare policy? Well, many are sounding the alarm bells on the future of healthcare policy. Fair enough. But what exactly happens is not yet clear. Republicans do seem to want to prioritize refashioning healthcare with their policies, but earth-shattering reform is by no means certain. This is in part given what is expected to be the tight margin in the House, relative moderation in the Senate, and the looming 2026 elections, if you can believe that. Here are a few more details about some of these political complexities. First, the House GOP has always had a hard time keeping the caucus together. It has far-right members as well as more moderate to conservative ones. The ideological split has been pronounced. We have seen high-profile failures to execute on the most ideological of issues in the past 2 years in the House. Second, the Senate as a body, especially due to the filibuster rule, tends to be more moderate in policy, although this is not always the case, and we will see a more conservative GOP in the upper chamber now. The filibuster rule requires 60 votes on most legislation, where budget reconciliation requires just a majority vote. Two moderate senators, Alaska's Lisa Murkowski and Maine's Susan Collins, could hold great sway. Note my word could, and we'll talk a little more about that soon. Related to the above, budget reconciliation can be used for policy changes, but it is by no means a clean process, complicating that issue. Trump could be a wild card as well. If he is looking for a lasting legacy, as some suggest he is, that could militate against pursuing controversial healthcare initiatives. Next, previous failures play into the equation too. Notably, previous efforts to repeal and replace the Affordable Care Act and restructure Medicaid went down in flames in 2017. And last, let's talk again about the 2026 election. The House is always thinking about keeping control because every one of their members runs every 2 years. In the case of the Senate, which has 6-year terms, roughly about a third of the Senate is up every 2 years. Well, while the Democrats had most of the seats up in 2024, that flips in 2026. The GOP has to defend 20 of 33 seats in 2026 to keep its majority. So again, attention is now turning to 2026 and what could certain controversial legislation really mean to a senator or a congressman keeping their job or control of the chambers. So with more known now, what might happen on healthcare? Let's get into that a little bit. So number one, let's talk regulatory changes. While sweeping changes are not certain from a lawmaking standpoint, it is fair to say that more conservative elements in a Trump government would push for traditional GOP policies on the exchanges and Medicaid that amount to anti-coverage expansion policies by using their regulatory authority. A return to state-friendly waivers, including work requirements in Medicaid, are sure to occur. On the exchanges, less promotion and funding of enrollment seasons in the exchanges is likely certain too. More generally, Trump's desire to rein in the regulatory regime will mean a slowdown in healthcare reform and seismic changes in healthcare generally. Let's talk exchange premium subsidy enhancements. Well, betting odds are that the enhancements will sunset. The GOP will not prioritize spending here, while it would impact some GOP constituencies for sure if the premium enhancements sunset at the end of 25. The GOP would not see this as terribly impactful politically and could blame it on the previous administration. There is a slight chance that the end-of-year vote coming up could include a 1 or 2 year extension of enhancements through 2026, or that a master budget deal sometime in 25 could include something very similar. Let's now talk ACA repeal, including sweeping Medicaid changes. In truth, Trump and his VP partner, J.D. Vance, sought to downplay talk of ACA repeal, but they did weigh in on possible changes during the campaign. GOP Speaker Mike Johnson also sought to downplay repeal talk, but spoke of the need for sweeping healthcare changes. The 2017 failure to repeal and replace the ACA and the concomitant political implications are still in the GOP's minds. But that doesn't mean that Trump, Johnson, and the Rightist Freedom Caucus may not seek to push a repeal and replace initiative again, including getting rid of the exchanges, rolling back Medicaid to historic levels, and devolving health care to states via block grants in Medicaid and for the uninsured. But GOP members from swing districts could seek to stop the repeal. It is important to note that exchange enrollment tends to be greatest in red states, as many of these states did not expand Medicaid. My assessment is that about 3/4 of enrollment is in red states or states that were swing states in 2024 that Trump won. The Senate could also come into play here. If the House caucus and the White House teamed up to repeal and replace the ACA, the Senate might have different thoughts. Murkowski and Collins, the two moderate senators I mentioned earlier, would likely be against such a repeal move. But with at least 53 votes, the GOP caucus could lose their support and still force changes through budget reconciliation. At the same time, there are some other GOP senators that are probably conservatives, but have expressed reservation about going back at the ACA again. So again, the Senate could be up in the air too. We must remember too the popularity of the ACA, as well as the fact that about 45 million have gained coverage either through the Medicaid expansion or the exchanges, not counting the tens of millions more who benefit from up to age 26 coverage and protections for pre-existing conditions. Congressional people and senators all understand that the ACA has become relatively popular among the American population and may not want to go down a radical repeal and replace reform move. With that, we're going to take our second break now before we come back and talk about some other healthcare issues that could be in play. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. We hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the recent election that looks to have given the GOP a trifecta, as it's known. The House, maybe, the Senate for sure, and the White House for sure, in control at least over the next 2 years. And what does this mean for healthcare policy? Well, we've reviewed, already the possible ACA repeal, the exchange premium subsidy extensions, and some regulatory changes. We're now going to get to at least 3 other issues here before we take our next break. We're going to pick up now with Medicare and Medicare Advantage. So Donald Trump has gone on record not to touch Medicare. Trump, other Republican lawmakers, and Republican policy groups have suggested that MA could become a default choice for Medicare beneficiaries. As much as I support MA, this could be a complex and controversial issue given recent benefit reductions, rural access, and criticism from both sides of the aisle on prior authorization and other issues. That said, a GOP Washington will be much friendlier to MA than a Democratic one, which could further propel MA's growth. But that is not the same thing as thinking MA will go untouched. Indeed, many congressional Republicans and policy groups have singled out MA for needed reforms in the following areas: quality bonuses, risk adjustment reform, rate reform generally, marketing reform, and supplemental benefits. So my prediction is that there will be bipartisan consensus for changes in many areas of MA, as many want to bring more accountability to the program. This also will come from the need for budget reductions, as well as the anti-corporate welfare mentality that many GOP lawmakers have. Let's next turn to Medicare drug price reform. Many conservative GOP lawmakers and policy groups are arguing Medicare drug price negotiations should be repealed. They argue it is all about the free market and innovation, but amounts largely to the fact that my party is in the hip pocket of Big Pharma. There really is no free drug market out there. Trump sponsored some drug price reform as president in his first term as well. He also does not have a great relationship with brand drug makers, but he recently seemed to back away from one of his proposals from his first term regarding international reference pricing. So Congress could want to repeal Medicare drug price negotiations, perhaps, but Trump may not want to do that. And there may be any number of House and Senate GOP members that also balk at repealing Medicare drug price negotiations. Congress, again, could have a hard time getting the votes to repeal Medicare drug price negotiation, given its relative popularity with the American public. Like with the ACA, the populist in Trump would also have to think long and hard about repealing the law. Let's move on to the antitrust agenda for plans, pharmacy benefit managers, and providers. Trump and the GOP may be friendlier to health plans than perhaps the Democrats would have been, but that does not mean there will not be some scrutiny, not only of plans, but of PBMs and providers. There are many GOP lawmakers who view reining in massive consolidation, PBM reform, and examining vertical integration as critical. So a good deal of this might be driven by Congress rather than the White House. At the same time, the populist streak in Trump could mean agencies that are more friendly to consumers and opposed to at least some consolidations. Future VP J.D. Vance is known to understand these issues and is very sympathetic to these competition issues. For example, many predict that the Federal Trade Commission lawsuit against PBMs will likely continue even under a Trump administration. With that, we're going to take our last break now, and we'll come back to tell you if seismic changes in healthcare may not move forward. What's sort of the bad news about things that likely will pass that can concern many people in terms of health policy? Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the election and what might happen with healthcare policy with the GOP expected to have a trifecta controlling the House, Senate, and the White House. So we've just spent a little bit of the podcast talking about how seismic changes like the repeal of the ACA and major restructuring in Medicaid and things like that may not be in the cards, depending on what lawmakers, largely moderates in Congress, want to do, or even what President Trump may do, given the fact that he'll be probably looking for a legacy here. But there is some bad news here for sure on healthcare policy. Even if you assume Trump and GOP leaders shy away from massive healthcare changes due to a lack of votes or fear of voter retribution in 2026 or wanting a legacy, it is quite likely that enough votes will be there in both chambers to impact key healthcare coverage initiatives, and it will likely hurt them to some degree. Trump and the GOP are firmly committed to extending the Trump tax cuts set to expire at the end of 2025. With Social Security and Medicare pretty much off the table, Trump and the GOP will likely target other healthcare programs, including the ACA and Medicaid for savings. Republican or conservative healthcare policy groups do propose some radical changes, some of which are above and we think are uncertain, but others are more muted and are rooted in budget savings rather than sweeping policy changes. Here are a few examples that I think could be enacted under a GOP Congress to save budgetary dollars. So let's look at what's known as the federal matching floor in Medicaid. Conservatives think the 50% federal matching floor in Medicaid encourages liberal states such as New York and California to significantly augment coverage and benefits. As such, some want to eliminate the minimum 50% match to richer states. In essence, this 50% floor takes away the calculation which essentially sets the federal financial participation rate based on the relative poverty of states. The floor is 50%, and it goes up there based on the formula as states are poorer and poorer. A number of states, including New York and California and others, would see a precipitous drop in their federal financial participation rate below 50 to something well below that. And that would be a significant concern for these states that are relatively rich. They have built up major social service infrastructures, in part because about 50% of it is paid by the federal government. and they would clearly have budgetary problems and might be forced to pull back on their social service safety nets if this kind of proposal went through. So that's the 50% federal match floor in Medicaid. I would also note that some of these policy groups are also talking about reducing funding in other social service programs as well. So that would be one major piece of Medicaid that could impact coverage in some states. Another proposal that is short of repealing the ACA Medicaid expansion would also change the current 90% federal matching rate for the expansion populations in Medicaid and move it down over time to each state's regular Medicaid match percentage. So there are somewhere around 24 to 25 million people that have gained coverage through the ACA Medicaid expansion to 135% of poverty. That reimbursement again is at 90%. And under these kind of proposals, the match rate could go down. In poorer states, it would go down from 90 to say 80 or 70, depending on their matching rate. But in richer states, it could go down to the 50% floor or potentially even lower if getting rid of the 90% for the ACA Medicaid expansion population is twinned with reducing the federal floor of 50% as well. So that would also have major repercussions, perhaps in all of the states, rich or poor, that expanded Medicaid under that ACA Medicaid expansion provision, where they get 90% federal match. Here's another example of something with budgetary impact that could also impact coverage. If exchanges are not repealed, the enhanced premium subsidies would clearly go away, in my view. Benefits could be made less generous potentially in legislation, and the current premium and cost sharing rules could be played with as well, perhaps making them less generous as well. So, again, something on the budget side, savings by changing benefits and changing subsidies. That would be labeled sort of a budget initiative, not an outright repeal of the exchanges, but at the same time, it would have far-reaching implications on affordability in the exchanges and probably coverage and access over time. Another example is while this would take more moderate votes, the GOP could also save dollars by adopting a block grant or per capita cap strategy just for Medicaid. Now, this is a little more along the seismic change range, but is a little more tempered than what was done earlier in 2017 in attempting to repeal the ACA. In 2017, the GOP wanted to repeal the ACA and send block grants down to the states to cover both Medicaid and people covered by the ACA that were previously uninsured. In this case, this would be sort of a block granting or a per capita cap strategy just for Medicaid, not including the exchanges. This could be sold again as retaining an entitlement, but significantly diminishing it and shifting costs to the states. You could also see the Congress adding in work requirements, which would further scale back coverage and spending in Medicaid. So that's another example of something they could do on the budgetary front. And last, again, moderate votes would be needed here, but some reform of Medicare could include making annual federal contributions more of a defined amount each year that is inflated annually. This could be done for MA as well as the traditional program. Again, this could be pitched as keeping the entitlement, but shifting cost in the future to beneficiaries. So those are sort of the things that I think are more probable, sort of these budgetary changes that impact healthcare coverage and generate savings, as opposed to perhaps seismic changes, which we talked about earlier in the podcast. So let's get to a quick conclusion here in the bottom line. Well, sweeping healthcare changes are very dependent on whether Donald Trump pushes such an agenda and whether a few lawmakers in each chamber balk at major changes. In the Senate, if you assume the two moderates would not support sweeping healthcare changes, you would need two other GOP senators to balk at major changes. In the House, the margin will be such that 3 to 5 GOPers could sink major healthcare changes in that chamber as well. In the end, all of this comes down to time and circumstances. And as the new Congress rolls out, we might start to get a quick taste of how adventurous Donald Trump wants to be and how adventurous the House and Senate GOP want to be in terms of healthcare policy changes in legislation. With that, we'll end this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.